Part 6. ARFID, Avoidant Restrictive Food Intake Disorder. Avoidant Restrictive Food Intake Disorder is a feeding and eating disorder. People with ARFID find it hard to eat enough for healthy growth, development and functioning. There are three main types of difficulties that people with ARFID can experience: sensory sensitivity, lack of interest, and a fear of aversive consequences. Some experience one, two, or all three of these difficulties. Let's consider these in a little bit more detail. Firstly, sensory sensitivity. Young people with sensory sensitivities may avoid food because of its sensory characteristics, so the taste, texture, smell, or look. Some young people are super tasters and can have strong preferences for specific brands of food. Children with selective eating often only eat foods that are of a specific brand. And that's because they crave predictability and sameness with regard to texture, smell and taste. Something that is very difficult to achieve in home cooking, even home-cooked versions of a child-safe food. They may notice even small changes, particularly in new improved recipes, and a previously accepted food may suddenly be rejected. Secondly, lack of interest. Factors which may contribute to a lack of interest in food or eating may include failure to recognise hunger or a lack of hunger, mood-based issues, low arousal, highly distractible and/or difficulties with attention. Finally, fear of aversive consequences. Some young people may be worried about the consequences of eating foods or certain foods. They may have a fear of choking or vomiting or of pain. Young people with strong fears of aversive consequences may find social situations highly anxiety-provoking due to the possibility of food or eating being involved. Many children and young people have strong preferences and dislikes when it comes to food and eating. This is entirely normal and appropriate. Many children will be fussy eaters and have particular habits when it comes to food and eating, such as not wanting food to touch, wanting to use certain crockery and cutlery, not liking certain foods, preferring certain brands, or feeling anxious and reluctant to try new things, and only wanting to eat a preferred food over and over again, getting bored of certain foods and refusing to eat them. This is entirely normal. Emotional responses to eating more or eating less, often resolves itself in time without any intervention. So what does it look like when a young person has ARFID? Well, young people will not be overly concerned about their weight or shape. They're not eating selectively in order to change their weight or shape. Young people with ARFID will usually eat an extremely limited selection of foods. These tend to be beige foods such as plain pasta, bread, chips, biscuits. Some people who develop a fear of aversive consequences may suddenly stop eating entirely. So there's likely to be a big impact on family functioning and dynamics, such as arguments at meal times, difficulties with eating out socially, and high levels of family stress. Young people with ARFID can present very young, as difficulties can sometimes start during weaning and early infancy. This is not the case where fear of aversive consequences is the main driver. ARFID can develop suddenly at any age in this context. There is usually no one single cause of ARFID. Instead, complex feeding difficulties usually involve a combination of factors. The risk factors presented on this slide are those known to increase the likelihood that a child may develop a complex feeding disorder. It's really important to note, though, that not all children will have all risk factors. Complex feeding difficulties, particularly selective eating patterns, are very common in children with autistic spectrum disorders, but not all children with complex feeding difficulties have autism. If you are concerned that a young person may have ARFID, please do not adopt a watch and wait approach. The earlier a difficulty is identified, the earlier an intervention can be offered, and the better the prognosis and outcome. Transparency is crucial, so discussing and sharing concerns with the young person directly, as well as with parents and carers, is the first step. Ensuring that you have consent and seeking consultation from services such as the Hampshire Eating Disorder Team can help you and the family, as well as the young person, decide on the next steps, which may include making referral or supporting a referral to the Eating Disorder Team. Feeding difficulties such as ARFID have usually developed over months and years and therefore can be difficult to change. Progress may be very slow, often requiring several months before any change is seen. And this is important to communicate to all those in the child's network so everyone is aware. Strategies such as force feeding, leaving long gaps between meals, or withholding preferred or safe food in the hopes that a child will eat healthy foods almost never work. Reward systems are often unhelpful as they increase anxiety in the children. Safe food that children with ARFID eat rarely meet healthy mealtime guidelines as they are often carbohydrate based. They may contain sugar and rarely include vegetables. So exceptions may need to be required for children with complex feeding disorders, as denying them access to safe foods may mean that they eat nothing during the school day. Many children with ARFID have strong contamination fears, and this is when safe foods are contaminated by being on the same plate as unsafe foods. For example, chips can be eaten, but if a vegetable is put on the same plate, the chips may be rejected. So try not to overly worry about healthy eating at this early point. Whilst we would all like our children to eat nutritious, well-balanced meals, children with ARFID often need higher calorie intake, especially at school, where children don't eat well. So always consult with a medical professional if you're concerned about the physical health and well-being of a young person and what they may or may not be eating. Now we'll consider some of the practical strategies and approaches for each of the 3 types of difficulties. Firstly, sensory sensitivity. It's important to hold in mind that selective diets are not what parents would choose for their children, but may be necessary in the early years to ensure that a child grows and gains weight. Use of oral supplements is also acceptable if it helps to maintain nutrition, growth and development. Reduction of sensory stimulation in the environment is often crucial. There are suggestions on this slide of how that can be achieved. In respect to introducing new foods, there are several stages in the process of eating a new food, and it may be necessary to work through very slowly in a type of hierarchy, so with each new step only being introduced when a child is comfortable at the stage they're at. So stages may include things such as looking at the food, seeing it on somebody else's plate or having it near their own plate, and then finally having it on their own plate but with no expectation to eat it. Then smelling the food, passing out the food to other family members, touching the food, bringing the food to their lips, licking the food, nibbling the food, and eating small amounts of that food. So often children require pictures to support these stages, as this can reduce anxiety, and negotiating, reminding the child of the target, what they're trying to achieve. Choosing suitable times to do this is really important. Avoid stressful periods such as the start of a new school term or Christmas. For those with a lack of interest in food, the approaches are much more behavioural. So developing a routine is really important. For example, in the morning, after we get dressed, we go downstairs and we have breakfast. And when we get home from school, we have dinner. Try to stick to the same times for meals and snacks will help cue a young person into eating both physically and psychologically. To help with this routine development, consider the use of external reminders such as setting alarms on phones. Think too about the division of responsibility at mealtimes. It's the adult's responsibility to decide when, where and what, so the timing, location and what the food being offered available is, but it's the child's responsibility to decide whether they eat and how much of it that they are going to eat. Getting the young person involved in food preparation can really help, so looking at recipes, buying ingredients, cooking or baking, and then eating together can dial down the pressure or stress around mealtimes that may have been built up. And remember that you're a role model, therefore ensuring that you take the time to prioritise eating and drinking regularly is important. A young person will look to you to form those habits. For those who have a fear of aversive consequences, a number of things can help. Often the anticipatory anxiety, so the what if this happens, doesn't typically match the reality. So gradual repeated exposure to eating will help the young person to challenge the thoughts that they experience about the likelihood of the fear occurring or their inability to cope with it if it does. Having others role model eating or drinking the feared foods can be powerful in also helping the young person to challenge the thoughts they have about consequences of eating this, as well as help them to gain confidence in taking those small steps in eating when they perhaps are feeling fearful. Positive feedback and praise can help reinforce desirable eating behaviour. Phrases such as nice eating, you're doing really well, may help some young people. And some young people may need psychological therapy and more support, such as cognitive behavioural therapy, to help them to manage and overcome some of those difficult thoughts and feelings and help them to achieve their eating goals. It's always important that the person delivering this therapy is accredited, works alongside a medical practitioner to monitor and manage any of the physical health risks, and also has experience and knowledge of ARFID and eating difficulties. Here are some resources that are suitable for young people, parents and carers, as well as professionals working with or supporting young people with eating difficulties and their families. We have now reached the end of Module 6 and the end of this Eating Disorders e-learning package. Please give some feedback by clicking on the QR code below.